Just wanted to share a couple points with you all today. As part of our sort of needs assessment on the ground here in Gaza, one thing we realized at one of the facilities was the use of anatomical landmarks for central line insertion. The critical care physicians, as well as the nephrologists placing temporary dialysis catheters, have been preferentially using the subclavian vein for access and sort of in second line the femoral vein. Now, the internal jugular, for whatever reason, has been avoided, and I think part of it is just about experience placing subclavian catheters and comfort with that in the providers that we've been meeting. However, just last week we were told that there were significant complications, including 3 pneumothorax cases. And in my experience, at least, that's 3 too many for one, and definitely 3 in a week is exceedingly high as a complication rate from central venous catheter insertion. And so, luckily, as part of this mission trip, one focus was to introduce ultrasound use in the low resource setting, which includes where we are right now. And we've been using these butterfly ultrasound probes that connect to an iPhone or an iPad so that we can have point of care testing available. Today's training included vascular access, lung evaluation, cardiac evaluation, and a quick, fast examination for trauma patients. And overall, that was very well received. But we had the opportunity to test this out firsthand today when in a patient that was anuric for, I think it was 72 hours, required temporary dialysis catheter insertion. And so we decided to use that as a teaching moment with the butterfly ultrasound. And what we did essentially is demonstrate how we could visualize the jugular vein, the compressibility to differentiate between the carotid artery and the internal jugular vein, and then used it under sterile conditions in order to show how easily we were able to insert a temporary dialysis catheter into the internal jugular vein, which, if we kind of go by our practice, I think globally, the most preferential site would be the jugular vein to reduce complications, especially infection related to it. And I think in this setting, when these catheters are potentially inserted and stay inserted for several days, especially more important to choose a site other than the femoral access, and a site that could minimize potential complications, hematoma, infection, etc., inadvertent arterial puncture. And using the butterfly and demonstrating that with a group of physicians that were involved in our training was truly remarkable, and it happened to be the first temporary dialysis catheter that was placed into the internal jugular vein, which I thought was pretty interesting to see, and most certainly the first one that was placed under ultrasound guidance. Now, I know there are other hospitals probably in Palestine or in the region where they are doing this, but in this specific center, it was the first time, and so I thought it was good to highlight that and show how bringing in some of this technology that's been sort of new over the last 5 or 6 years, how it can potentially change practice and really help improve patient safety in this case.